Hey, it's Jason Bradley from BodyWorx Physio. Just continuing our talk on knee injuries, what I wanted to dive more specifically into today was patellofemoral syndrome. So patellofemoral syndrome is basically where the knee sits on a little groove on the femur, so your patella sits on there, and as we move our knee, the kneecap glides up and down through that groove. So if you imagine that my two fingers are the femur and my kneecap's like that finger, so it sits in there and runs up and down through that groove. Now, depending on how our leg moves, the kneecap can be pulled out of position. And we're not talking about a lot of distance. We're talking in the order of, 2 to 3 millimeters. And that can be enough to have a drastic change on the way that the cartilage surfaces in behind the kneecap and on the front of your femur or the front of your leg bone can rub together and create pressure. Now, pressure on the cartilage is really important. One of the interesting things about cartilage within our joints is that it requires intermittent pressure, sort of like a sponge, to get joint fluid to move in and out of that cartilage surface. Without that intermittent pressure, the joint surface can't get correct nutrition, so it gets all its nutrients out of that joint fluid. So generally what happens with patellofemoral syndrome is we get the kneecap shifting laterally, just by a little bit, not by a lot. And what that does is it increases the pressure on the outside surface of the cartilage and decreases the pressure on the inside here. So what we end up happening is on the lateral surface behind the kneecap, we get a wearing away of the cartilage, and on the inside surface, because it's not getting enough nutrition, that portion of the cartilage goes mushy and basically goes soft because it's not getting correct nutrition. So there can be a number of things that cause this. We often see it happens in a group of causes. So what we generally see is a weakness of the VMO, or the little muscle that runs down the inside of your quadriceps area, a tightness and an increased strength in the vastus lateralis and your ITB, or your iliotibial band. And the interesting thing with the iliotibial band is when you look at a lot of our anatomy charts, we'll see that it's a really defined neat band down the side, but when you're actually in an anatomy class and you open up and you see a real life body of a human, what we actually see is that yes, there's a thickened portion of it, but the fascia, so the skin that surrounds all the muscles, feathers out from the ITB and connects into your lateral quad and lateral hamstring as well at the back. So it can be a problem for both of those muscles. The other things that we see is where people have got a weakened glute muscle, so their hip muscle, so that when they're doing any one leg squats or running or going up and down stairs, the hip muscle can't control that movement enough. So we get an inward movement of the knee, bulging inwards, and that can also cause the knee to be pressured outwards. Other common factors that affect this is pronation, or rolling in at the foot joint, because once again, rolling in at the foot joint causes the knee to rotate in and helps put pressure on that kneecap to force it out. We can also have a genetic component to it called an increased Q angle, and we do see this more commonly in ladies than in men. And what that Q angle is, it's the angle between the front of the hip, the center of the kneecap, and the shin bone. And so increased Q angle, so if it bends in more, we see that puts more pressure on the knee because it basically creates an angle where the muscle is pulling from here and here, but the kneecap's in here. So it wants to go out to create the shortest point between those two pulling points. So those are probably the main issues that we see with patellofemoral from a body perspective. We can also look at things like improper training, so if you're suddenly increasing your volume, if you're starting to add in a lot of stairs, a lot of hills all of a sudden, improper footwear, so if you're wearing poorly supporting footwear, we generally recommend Asics and Brooks for most of our clients who have any foot or leg problems, purely because a lot of the other brands, while they might be great, pretty brands, don't always have great support in their shoe. So they sort of sell more based on their brand rather than the technology and the comfort of them. So those are the main things we look at that might cause patellofemoral pain. In order to treat it, what we look at doing is strengthening up those affected muscles that are a bit weak, so strengthening the VMO and the glute medius to help control that pelvis better, loosening through the ITB and the vastus lateralis and the lateral hamstring through dry needling, through soft tissue massage, through foam rolling. We can correct the feet, so looking at correcting the shoes, adding in corrective orthotics, so custom-made orthotics can be an option, but it's not our first one we pick. So we always want to pick the major things first and not jump to the most expensive option. So those are the big ways that we started doing it, as well as symptoms management, so icing for the inflammation and possibly using some anti-inflammatories. If you have any more questions, feel free to give us a call on 4952 7033. Jump onto our website, bodyworxphysio.com.au, where you can book in line even for a free session, or have a look at some of the other articles we have on our blog and on website. Thanks and have a great day.